I'm Don Griffith. I'm a urologist, and I'm also President and Chief Executive Officer of Uro Research. Uro Research will commercialize a new urinary catheter. The new catheter is called a tissue bonding cystostomy. It's intended for long-term drainage of the urinary bladder. The TBC is FDA and IRB approved for Phase 1 human trials. Tentatively, Medicare has approved hospital and surgeon reimbursement during the clinical trial. The TBC will follow a 510 regulatory pathway. The urinary bladder is normally a sterile cavity. Urethral or abdominal tubes are used to drain it. The Foley urethral catheter, shown in the left panel, was commercialized in 1936. The abdominal suprapubic tube was commercialized in ancient Egypt more than 1,000 years ago, utilizing hollow papyrus reeds. Both of the above drainage tubes are open access, meaning that external skin bacteria attached to the surface of the tubes multiply and then migrate into the bladder lumen. 100% of the above tubes harbor urinary tract infections after 2 months of continuous use. Neurologically and physically disabled patients use tube drainage for months and perhaps years. Some of the categories of patients are shown on the slide. It's estimated that 3 million patients use chronic tubes to drain their native urinary bladder. 100% of these patients have bacterial infection, and the infection cannot be eliminated, thereby creating much morbidity. The morbidity and resistance is caused by biofilms. Bacteria attached to the surface of the catheter replicate and multiply explosively and thereby create a biofilm. The biofilm is formed from cellular debris originating from the bacteria and from the adjacent tissue cells. As the bacteria multiply, the biofilm grows and migrates into the bladder lumen. Tinkoff peritoneal dialysis catheters are different. They have closed access. This graphic shows a Dacron cuff placed within the rectus abdominis muscle and attached to the Tinkoff catheter. Muscle cells and capillaries grow into the porous Dacron. This muscle bonding blocks migration of bacteria and migration of biofilm. By comparison, the Tinkoff peritonitis rate is approximately 1% per year, whereas the Foley and SP tube rate is 100% infection within 2 months, and the urinary infection and the biofilm are resistant to antibiotics, and therefore the infection persists for the lifetime of the catheter. Catheter-associated urinary infections are the #1 infectious disease. Muscle-bonded tubes should therefore reduce urinary infection and all of its side effects. The tissue bonding cystostomy mimics the Tinkoff design, but is a renewable catheter. The red and green internal drainage tube passes through the anchor into the bladder lumen. The blue anchor is a permanent implant composed of Dacron and coated with Dacron or Teflon. The internal drainage tube locks reversibly and watertightly in the anchor. The drainage tube can be placed or removed and replaced over a guide wire. The external cap inserts into the drainage tube. The TBC may prevent all catheter-associated urinary tract infections. Thank you very much for your attention.